Sure. All right. So I'm gonna try and be as brief as possible because I'm not trying to turn you guys into lab techs here. Alright, we're just gonna touch on most of the important stuff that I've seen, right, and some of the stuff that you can focus on when you do study. Alright. So the main thing, the form, SF 545, you know, plain and simple. That's the form that we use to record lab stuff in your medical record. Okay? So just make sure you remember that one. You'll see it again. Alright, blood collection method. What is the name of the blood collection method? Venipuncture. And the degree of entry into the vein?
15 to 30.
15 to 30. Alright?
And what's the name of the space that they use, the main one?
Alright.
Yep.
Simple. Alright. Alright, so 2 to 3 inches above the elbow is where you put the tourniquet. Okay? Then you're gonna wipe with alcohol swab, let it dry. Then you enter 15 to 30 degree. Okay? You can also use if you have like a specimen, an alcohol swab specimen. So you need to test alcohol levels on a patient. You don't use alcohol to clean that site, right? Not because it will definitely affect it, but you want to eliminate that possibility. Okay? So you use something like a soap solution or iodine, right?
So this slide is wrong too. I was brought up last time. If we were talking about lab and doing lab draws, your tourniquet is 3 to 4 inches. If we're talking about field medicine in the field treating a leg amp, it's going to be 2 to 3 inches. Okay, so 3 to 4 when you're doing lab draws.
All right, so when you're doing finger punctures, why shouldn't you squeeze when you stick the patient? So blood is coming out, right? And then you're gonna squeeze it to kind of milk it out. Why shouldn't you do that? What do you think? But it won't clot. So the thing with red blood cells, what's inside red blood cells is potassium. So if you squeeze it, it's a possibility that you're gonna lyse these cells, which is gonna cause artificial increase in potassium. So it will throw it up. That's why you shouldn't squeeze.
That's not what this slide
No, what I'm telling you, that's what.
Yeah, but
What does this slide say? Because I didn't
it
make
says
it.
massage from up the finger down towards the fingertip, repeat.
Yeah,
5
so
to 6 times.
squeeze is different from massage. So you kind of rub it, but some people will squeeze here, so that's the difference. So you don't squeeze, just massage it to get that blood flowing, alright? Then you wipe away when you stick it, you wipe away that first one to prevent tissue dilution. Wipe away that, and then the blood will start flowing, okay? Alright, how many inches above side should the tourniquet be placed? 3 to 4. Is that reflected in the book?
Yeah, so when Blackman brought up last week, I just wanted to confirm, and I went back to the lab manual, and it is 3 to 4. It's one of those things where it kind of contradicts based off what you're talking about. So 3 to 4 for this, 2 to 3 for field medicine.
Alright, so just make sure you always go based on what's in your book, okay? Alright, at what angle in the needle is the needle introduced into the skin? What angle? 15 to 30, alright. A tourniquet should not be left on for more than how long? Alright, why is that? Hemolysis. Same thing, okay? Alright, microscope parts. Alright, so you have 4 main parts. So you have the arm, stage, mechanical stage, and the base. All you have to do is just memorize these.
So I have a way to help you remember those, right? So when I think of arms, I'm thinking of picking somebody up and supporting them, right? So the arm supports the magnification for the stage allows the light to pass through. So I'm thinking of somebody standing on stage and a light being shined right at them. And then the mechanical will hold, and then the base where everybody rests on. So basically, if I'm sleeping on the base is where the microscope rests. Because they will ask you the description of the lab, the microscope part of the microscope, and you have to label what that is.
And they usually give like a little picture.
Right.
And they're like, hey, what is this portion of the
Everybody good? Alright. So this one has a lot of information on here, right? So the stuff that I have here, I just took out the main stuff, alright? So for the objectives, you have the 10x, which is a low power, 45x is the high power, and 100x is oil immersion. Right, so I saw that in one of the exams before they asked you which one is oil immersion. So you can always refer to this, but and when you do your studies, cover all of this stuff. But these are the main things that I think you need to know, like low power. What is low power? You know, what do you look at for low power? What high power? That's where you do differentials, right? And oil immersion, you do differentials on those two. So you can do a broad view on, you know, like some of the cells, you can do a broad view with 45x. But oil immersion, that's when you look, you do the actual manual differential and, you know, look at on the cells and you get a better picture of the inside of the cells and so on.
One that's easy to overlook that's been on the test before too is when it's talking about that magnification power. So when it says near the ocular lens or eyepiece, the looker on the top of the body tube has a magnification power of 10x, right? So instead of talking about the low power, high power, and oil immersion, it'll just talk about the magnification power alone. Just know what that number is.
All right, complete blood count. So CBC, that's where you perform the CBC, right? That's what you call complete blood count. So it has 5 different tests on there, and that's on the test too, right? How many tests are on the CBC? 5. Okay. And if you didn't know, erythrocytes are the same thing as our red blood cells. I don't remember ever seeing hemocytometer. Have you ever seen anything on the hemocytometer?
No, not really. I mean, if anything, just know that's the only thing they're using to measure. Like, the only measuring device I've seen on the test for lab would have been this.
So that, you would probably use it in the field. You know, if you deploy burns or something, you may have one of those to do some manual differentials in the field. But other than that, you know, you're not going to use it. You're going to use one of the machines. All right, so these are the reference ranges. Right, so just memorize it. Okay. So women, 12 to 16, men, 14 to 18, infants, 17 to 23. Do you think that infants would be, you know, the lowest?
So a couple things to help y'all out. First off, to make it understandable, right? Who has the most weak immune systems? Babies and old people, right? So because they have a weaker immune system, they require more cells and require more nourishment and whatever else. So your infants are always going to have higher numbers, right? Now the previous slide, can we go back to that real quick? Because there's a couple big things we'll hit on, right? They talk about this red cell count on your test. A red cell count that drops below normal is an indicator for anemia. One that rises above normal is going to indicate dehydration. And I'm about to show you here. I want you to pay attention to the 4.2 and 3.6. Now go to the next slide. Look at your hematocrits here, right? 4.2, 42. Right? They're the same exact numbers. So your hematocrit is going to be very similar to your normal red blood cells, right? And then 36 for women, and now it's 37 here for hematocrit, right? So you can at least know and associate hematocrit with your red blood cell value, and you should be right there where you need to be for your ranges. And then if you see here, 12 plus 4 is 16. 4 plus 4 is 8. So all you're doing is adding 4 for the ranges here for your men and women for your hemoglobin. I don't know if that helps, but I was always getting tripped up on the numbers and had to find a way to know those for the lab values.
What is there? Alright, so total weight. Alright. So 4,500 to 1,100 for cells per cubic millimeter. Children 5,000 to 15, newborn 10 to 30. So leukocytosis is the increase. So these are terms that you probably should know. Leukocytosis, increase. Leukopenia is decrease. Okay?
Why would we have an increase in white blood cells? I know we talked about this before. What's up?
Your body's trying to fight something off.
Yes, so you always have a higher white blood cell count when it's fighting off a disease, right? And there's a reason why they're in this order. There's an acronym called just PMA, Performance Mark Average, so that you know it's pneumonia, meningitis, and appendicitis. And remember your white blood cell counts, at least for child and newborn. Again, your newborn has a weaker immune system than your child, so you're going to require more. But it's literally just the first number times 3 to get your range there. So 5 times 3 is 15, 10 times 3 is 30.
Alright, so an increase in this can also, be something like, we'll call it cancer. So just bear that in mind also. Does anybody have any question? So leukocytosis, these terms, make sure you pay attention to these. Leukocytosis and leukopenia. Know the difference between the two. Because, even though I'm an update, that tripped me up sometimes on the test. So leukopenia, oh, I remember that one, leukopenia, right? Small. Peeny, weeny, small, right? So that's one of those ways that you can remember. Because I'm telling you, man, when you're going through that test and that stress start mounting and you see 5 questions back to back that you don't know, you screw up all the easy stuff too. So just bear that in mind, just memorize these little things. Am I missing anything on this?
No, I mean, they sometimes talk about the diseases, but I have not found a good way to remember those, to be honest
with
with
y'all.
y'all.
Read and just try and memorize this. Alright. Eosinophils. So these, I see this one every single time. Alright? So eosinophils, so when you have a parasite or allergic reaction, you see an increase in eosinophils. Okay? Basophils, large dark blue granules, and you mainly see them in inflammatory disorders. Alright? Lymphocytes, clear sky blue, scanty with uneven granules. And you see these viral infections. Monocytes, see these mainly fungal infections. So monocytes is the largest normal WBC.
There's some things I want you to pay attention to with each of these categories, right? So the first thing I'm going to want you to pay attention to, right? You have blue mentioned twice. So you need to know that your dark blue is basophils and your scanty, sky blue is scanty is your lymphocytes, right? Now, each of these different white blood cells has a function, so I would just pay attention to that, what that function is, right? Eosinophils, allergic reactions. Basophils, inflammatory disorders. Lymphocytes, viral infections. And then for monocytes, fungal infections, right? Literally just a 2-word sentence for each one to remember them. And the thing right here they like to test, your largest normal white blood cell count is going to be your monocytes, right? Now don't mix it up with the next part where, like I said, they're going to screw with you. The largest percentage of leukocytes are found in your neutrophils. So your largest size is your monocytes, but the largest percentage of white blood cells is going to be in your neutrophils.
If you take nothing else away from this slide, eosinophils, alright? Make a note of eosinophils, basophils, and that's exactly what he said, because I see this in every single test that I've done. right? All right, shift to the left. All right, so shift to the left is pretty much when you have a bunch of hematuria cells. Okay, so just like if you have a number line, or X and Y axis, right? And you start from 0 and you move all the way out, and the numbers increase as you go out, right? Everybody seen X and Y axis before? So the numbers increase as you go to the right. Numbers decrease as you go to the left. So a shift to the left means, the numbers are smaller. So the measurements of the cells are smaller. So that's why it says shift to the left. If it's to the middle, then obviously they're normal. If it's shifting to the right, they're more advanced WBCs or whatever cells. And so that means that they probably you have a some form of chronic infection or something. Right? And also the shift to the left could be something like, what do you call it? So, what do you call it? Cancer? Or the bone.
The bone?
What do you call it? Cancer? Leukemia.
Oh,
Somebody
leukemia?
said-
Okay,
somebody
okay.
said
Oh,
leukemia.
cancer of the
Yeah.
bone? Okay.
Yeah, yeah, yeah. Somebody said it.
That second bullet point right there has been an exact question on the test, and I want it to make sense to y'all, right? So you never get confused, right? So I said that your white blood cells increase and create more when they're trying to fight off disease, right? So keep that in your mind. A falling white cell count with the number of maturity of neutrophils progressing toward normal indicates recovery. So your big group of white blood cells, now it starts breaking down back to the normal range it's supposed to be in, is going to say that your body is recovering. It's not needing those extra white blood cells anymore. Does that make sense? Falling white blood cells progressing toward normal indicate recovery.
Does anybody have any questions? Okay, so this slide is the slide that I always see this one on there too. So psychophilic, mesophilic, and thermophilic. How I remember these is, so for cold weather, you only love cold weather if you're psychotic. That's how I view it, right? So psychophilic, cold. Mesophilic, my body temperature. That's mesophilic. Okay? And then thermophilic, every time people mention something about thermal, it's hot. Okay? So crazy people like cold weather. Mesophilic, that's my body temperature. And thermophilic is hot. I see it all the time, and that's how I remember it.
So you see the MONT I was talking about before? Moisture, oxygen, nutrition, and temperature. And I don't know why people get these confused too, but I'm going to help you out. I know she mentioned it the other day. So you got pathogenic and non-pathogenic, and then you got your aerobes and anaerobes. All right? So all it means is for pathogenic is bacteria that causes diseases. Non-pathogenic is harmless bacteria. And our aerobes include oxygen. Anaerobes do not include oxygen. All right? I don't know why people get confused on those, but that's what those mean.
And just know what's required for these microbes to grow. So another main thing that a lot of people mix up is the characteristic, morphological characteristic. Coccus, bacillus, and spirochetes. So if you look at coccus or cocci, plural cocci, all the letters are curved, right? So you can use that and just know that, okay, cocci, circular, spherical, everything is curved. Bacillus, look at the word bacillus. Everything looks like, it's in, kind of like rod shaped. Everything looks rod shaped. So bacillus, everything is rods. That's how you can remember that. And the word spirochete, spiral.
So I have a corny way to remember it for this one. I just use circle because it starts with a C to remember spherical. And this is a Harry Potter reference, but I think of bacillus, which sounds like bacillus, which is a snake, which would also be kind of rod-shaped to remember that one. And then I remember spiral the same way, right? Spirochetes, it says spiral in the damn name to know it's going to be corkscrew-shaped.
So I don't think I've ever seen anything about toxins or.
No.
So,
I mean, you know what the word endo and exo means. That's
Yeah.
all you really need to know if that word ever pops up on the test.
okay, so 4 growth requirements for bacteria. What are they?
Moisture.
Oxygen, nutrition, and temperature.
All right. Go again. All right, so gram-positive cells retain crystal violet stain during decolorization and retain the violet stain. So those would be purple. You have a purple color, gram-positive.
So I thought of this the other day on how to remember it too. The word positive starts with a P. What's another color for violet? Purple, right? I had a weird way to remember pink before. It might help you out. I was thinking of gram-negative pink. I was thinking of a girl finding out that she was excited that she all of a sudden didn't pop up pregnant because she got a negative pregnancy test. So I did gram-negative with pink.
So those are the 2 main. You just memorize these 2 things. Crystal violet. Sure, you can memorize those 2. I know what times that each of these have to,
Saffiron is one that's been on the test a couple
Yeah.
times.
Yeah, so just remember those. Memorize those. I don't know of any catchy way to remember them, so let's see what we can do those. So antigen is a substance that when introduced to the body is recognized as foreign by immune system and causes detectable reaction. Antibodies are specific defense proteins produced when an antigen stimulates individual cells. So those are plain and simple. Does anybody need elaboration on those?
So flu vaccine, for instance, right? There's antigens that are into any flu vaccine you get each year. What it's doing is it's put into your body, so then your body can then build antibodies to fight off if it's ever exposed to a similar strand of that flu. Does that make sense?
So RPR, syphilis. Okay? RPR, syphilis. So with the reaction with RPR is you look for agglutination. It's very simple. So black clumps against a white background. And if there's no reaction, you won't see any clumps. So RPR, syphilis, and you look for agglutination to see a reaction. If it's reactive, it agglutinates, and you'll see black clumps. Okay? If it does not, you'll only see a gray background.
Yeah, add one thing because it's going to throw you off, and I know it will, right? Both of these test for syphilis, right? But you're going to look for the key word and know what it's talking about, right? FTA, the fluorescent test, is for primary, secondary, and it's late syphilis. It's a more precise test. And then this one's just a sensitive, RPR is just a sensitive performed screening, which is the regular test for syphilis. I don't know if that makes sense or not, but they're gonna ask you which one tests for
Yeah.
syphilis, and you know the difference between those two.
So the doctor, what you report to the doctor is, the person is reactive when you do the RPR, right? But when you do the FTA ABS, it's positive or negative. Okay?
And then what's vitamin K?
Potassium.
Potassium. KOH, potassium hydroxide, and then it's usually going to be for your fungal or what's that?
Why do you think potassium
Oh, yeah.
Oh, is it?
Yes.
It's K on the elemental table.
Oh, that's what I mean. Sorry, that's how I remembered it for some reason. Potassium and K always seemed like they were synonymous with each other.
Yeah.
So, but that's just for fungi, right? So they will ask the KOH prep on the test, and that's for fungi.
Yeah, what percentage? What percent KOH? 10%. That's very important, but they probably put 2%, 15, 20, and then put a 10. So make sure you know that it's 10% KOH, right? So monospot, you use monospot or the dry dot to test for infectious mononucleosis. Okay? These are easy questions right here. So don't miss those. So RPR is used to test for what?
Syphilis.
This is used in detecting fungus.
Okay, wait.
What percent? Monospot, dry spot is used to test for what?
Mono.
Gram negative is what color? Gram positive? Right, urinalysis. There are three types of urine specimens and collections: random, first morning void, or 24 hours. Because it is usually concentrated and more likely to reveal abnormalities, they normally prefer you to use first morning void. So even when you do pregnancy tests, they like first morning void because the concentration is much higher in the morning. Okay? If you're doing it in the afternoon, then you might miss it on one of the more cheaper tests. But if you do it first in the morning, you'll get a more brighter positive because there's more in the urine.
We like to ask both of those questions right there on your, and don't mix them up. Least valid and routine urinalysis are the ones I'll throw on there. And then there's that 1,500 amount that I talked to. That's the same amount that of saliva that you produce daily too is 1,500.
Yeah, and also just know the range too. So know the range, they may ask the range and they may ask, average. Alright. So urinary output, what can reduce that is diarrhea, of course, because you're expelling a lot of fluids, and diabetes, you're expelling a lot of fluids too, because diabetics pee a lot. Okay? So you're gonna be peeing out a lot of stuff, so that may affect urine output. And also you can remember some of the preservative: hydrochloric acid, boric acid, glacial acid, formaldehyde, toluene, and thymol. So these preservatives depends on what they're testing for. Because some preservatives counteract certain tests, so they'll have different tests for different preservative for different tests. All right, color.
Know what your cast is too there.
Mm-hmm.
I said know what the cast is. That one's a test question all the time.
Yeah. And the high power field, the field that you use to look for cast is low power field, so 10x. I don't think it's on there. All right, specific gravity. Normal range 1.015 to 1.030 during 24-hour period. In the presence of disease, the specific gravity of a 24-hour specimen may vary from 1.001 to 1.060. Specific gravity is measured with an index refractometer. If you are dehydrated, do you think you'll see a lower or higher specific gravity? Well, so more concentrated urine. If you chug a lot of water, the urine is lighter, and also it has less dissolved stuff in it. So what's the normal range for specific gravity?
1.05 to 1.0.
Right.
Easy way to remember that too is you literally move around the normal 1,500 for average. You can make it 1.015 to start your range for your normal specific gravity.
Alright, so more than 3 cells per high power field for leukocytes may indicate disease somewhere in the urinary tract. Generally, in the lab, if you see one WBC, they're gonna look further. So if you have a machine and it tests and it says, okay, we identified, or the machine is saying identified WBC, then you're gonna do a manual to see if there is more, because sometimes the machine will miss it. So, but for the purpose of the test, go with this. So red cells are not normally present in urine. So if you see 1 or 2, but the normal range is 0 to 2. All right.
Bullet number 4 and 5 have been on the test before, so I'd put stars next to you, next to both of those, for anemia, and then 50,000 for an acute infection.
All right, so glucose and ketones, and uncontrolled diabetes. What do you think those have in common? Why do you think the glucose and the ketones will show you that there is uncontrolled diabetes?
so byproduct of that is ketones.
So what byproduct does it use then? To get, what breaks down in order to get ketones? Fat. Fat, yeah. So that's why people who fast, if you test their urine, you'll see an increase in ketones in their urine because they're breaking down the fat in order to get energy. I'm not sure if the walk-in blood bank stuff is gonna be on the test, you think?
It's been on the test a couple
Yeah.
times, and I think they have another chapter mentioned about
Yeah.
blood donation. Two things I think on
Yeah,
top
so-
of that. So I would pay attention to it.
So 10% of the ship's company, they use for walk-in blood bank. Okay. And that's it. Is there any questions regarding that? So all the stuff that we